Dr. Sims, you mentioned mental health, and as you know, I am a psychiatrist, and by the way, the NBA has led on this conversation. The NBA has had relationships with psychiatrists and other mental health professionals, and made sure that your players had access to any mental health services that they needed for a long time. Can you just double click quickly on mental health, and you can either talk about it more broadly or talk about what activities or how you thought about mental health during the bubble and the quarantine?
We thought about this through and through. When I'm a part of the planning for an event or experience with the NBA, one of the things that I always help to put together is an emergency action plan. What do we do in worst case scenario? What are the resources? We also had a mental health emergency action plan. Not only did we bring physicians to the bubble to help us take care of the people who were there, we had a clinical and sports psychologist with us in the bubble, with office hours, on-call hours, and we partnered with local psychiatry and psychology professionals to be on call. Knowing that we had a large number of people there, we didn't want anyone to have to wait for services. So we had telehealth options that were available. We had in-person options that were available in the bubble. So that was the extent that we went to make sure we could take care of people. Now, keep in mind that our teams also, all 30 of our teams, they have mental health providers that are associated. So we made sure that they were ready and on standby for anything because they have the relationships with the players and the team staff. But for those who didn't have that provider or that access, we made sure we were covered so that anything that came up, whether it was people having difficulties with the quarantine, people struggling being away from family for extended periods of time, anything you can think of, we made sure that we were ready. And if we got to that point of an emergency, and we know that sometimes those happen, that we were prepared with an action plan, that we didn't just have a knee-jerk reaction, we were planned and ready if the worst case scenario did happen. We had lots of activities in the bubble that we thought about to take the everyday stress out of being there, whether it was people being able to have bicycles available to ride around the campus, fishing. We had lots of people participating in pickleball. That was one. Slam ball was another. Cornhole. Whatever we could do to take people's minds off of just the everyday work and to do something fun. Again, I mentioned that we made sure to be attentive to people's ability to exercise and get some physical activity in. So, you know, there was about a 2-mile loop around the campus where we were. People were out running and walking and hiking. So they had that opportunity. We did have the gyms open for people to get some exercise in, and then the swimming pools were open as well. We sometimes have to limit the numbers, but we always thought through how we can help people get some fun activity, physical activity in there. So there was a lot. We did movie nights with a television or a projector and a screen out on a lawn, physically distanced, better ventilation. So we did as best we could with the tools we had to make sure it was an enjoyable experience.